Welcome back. February is National Children's Dental Health Month, and statistics show that 47% of third graders in Virginia have tooth decay. That's almost half. Dr. James Nickman is the president of the American Academy of Pediatric Dentistry. He joins us now with some tips to help keep kids' teeth healthy. Hey, doctor, how are you?
Great, Cheryl. Thank you for having us on today. As you mentioned, cavities are one of the most chronic childhood diseases, actually 5 times more common than childhood asthma. And the sad part is, for the most part, they're entirely preventable.
Really? So why do you think pediatric tooth decay is such a problem in the U.S.? And with baby teeth, I mean, do they really matter?
You know, they do. And I think a lot of it's just, I know in my household, I have several kids involved in multiple activities. Our family's almost overscheduled, so we tend to grab a lot of quick things on the go, especially snacks. And I think looking at that, especially if kids are consuming that frequently, you have some not so great outcomes for teeth. So one, I'd recommend, families see their dentist on a regular basis, but also try and, if you're on the go, try and grab healthier snack choices for their kids, like apples, things that aren't going to stick to the teeth. Will probably have a better dental experience moving forward.
So, okay, here's a question. So a lot of kids like to chew gum, and you see the gum with sugar or the sugar-free gum. Is there a difference, or are they both bad?
No, the sugar-free gum is actually good for the kids, especially if you're on the run. The sugar-free gum, the bacteria in the mouth that cause the cavities really can't do much with the sweetener that's in there. So when you're chewing the gum, it stimulates the saliva flow. That helps to flush food out of the mouth. As you're chewing it, it helps to pull the sticky crud out of the crevices of the teeth, so that, in effect, you're kind of doing a quick brush, as well as, I'm sure, doing a little breath freshening along the way, too. But no, that's a great, if you don't have time to brush, you're on the run, definitely a stick of sugar-free gum now and then will help, the kids get keep their teeth in good shape.
Very good to know. So what are some other things that kids should be doing? Is there a good toothpaste? I mean, should they be flossing? How often should they be going to the dentist? Do they need to do that as a kid?
That's a great point. I think really, since a lot of this is preventable, I really want to see these kids before the cavities have even had a chance to get their start. The American Academy of Pediatric Dentistry recommends that their families establish their first visit with the dentist by a child's first birthday. That may seem early because a lot of times the teeth are just starting to come in, but we spend a lot of time with the families talking about, what's going to happen, what's going on, essentially an owner's manual for their child. So hopefully, their child has a great lifetime of oral health. We spend a lot of time talking with the families also about habits to avoid, foods to avoid, also good healthy feeding options. Kids at that young age also tend to be very prone for trauma, so the dental home provides them a home base to seek care in case their child has an unfortunate bump or fall. One thing, parents can seek more resources on mychildrensteeth.org. It's got great preventative information as well as fun activities for kids.
Oh, wow. Thank you so much for all this information. We really appreciate it.
Yeah, thank you very much for your time today, Cheryl.
All right, have a great day. All right, time now to check in with meteorologist Miles.